St. George Northwest area. And we will speak a little about these. And one so far has been identified in Gov in St. John. Now, I will speak a little on the local cases because they are of particular concern. So, of the cases that we are most concerned about, the cases that I mentioned that were located in St. George Northwest. Now, these individuals were somehow linked to a cluster that we are beginning to identify. One of these individuals attended one of those party cruises, and we are following up on that lead. This individual, along with another case, also attended a farewell party, or a house party, or a yard party, in which there were in excess of 30 plus persons. Right now we are trying to identify these individuals. What we can say is that from that party, so far we have identified 5 individuals who have tested positive. It is likely that this party was a super spreader event. So all of the individuals who attended that party on Thursday, all right, that is Thursday last, I can't remember the date. These individuals may have contracted COVID, and they are out there in the community. They are also among their family. So right now, their family is at risk as well. Of particular concern as well is that 2 individuals presented to the Guav Health Center yesterday, a minor and a parent. So far, we have received the result for the minor, and the minor is positive. Now you can imagine, young children do not have much of an independent life outside of their family and their parents. So I am certain that it is possible that it is an adult who was the first infected and brought that into the family. All of these cases are presently being investigated. The contacts are being actively sought. Now, we know that over the past days, we have had quite a number of large social activities, all of which we know of are super spreader events. This is what we have been warning the public about. This is what we have been speaking about time and time again. And from the looks of it, it is now here. It's no longer the time to make compromises because there is no negotiating with this virus. From what we are seeing, we are concerned that it is the Delta variant that may be circulating in our population. We will send our samples to for sequencing at Caribbean Public Health Agency. We have sent a small number last week, and we intend to do the same this week with these cases. But everyone should be more than concerned that what we are seeing right now could very well be the start of our outbreak, our wave. So I urge everyone to do all in their power to mitigate the impact of this on their families. And I'll stop there for now.
Thank you very much, Dr. Charles, for that update on Grenada's current COVID-19 situation. No need to rehash at this point. Dr. Charles has been quite explicit in explaining the situation that currently exists and the need now more than ever for us to comply with all of the relevant COVID-19 protocols and to safeguard ourselves and our families. I turn now to Health Minister, Honorable Nicholas Steer.
Thank you, Philomena, and good morning to all of our viewers and listeners. We are in a situation that we have tried successfully to date to avoid, to delay, to prevent. But as we have warned, it is also one that we consider to be inevitable. As such, we have engaged and are currently engaged in aggressive contact tracing. These contact tracing exercises are even more excessive than are needed or that we would like, because contacts were involved in illegal gatherings, large gatherings. And as such, the contact tracing team has to do their best to ascertain who were present, and it's based on memory because no logs were taken and it was an illegal event in the first place. A private event at someone's home, but 30 plus individuals nonetheless. 5 of which, as the CMO has said, have tested positive. How we get past this, and how quickly we get past this, is dependent on how we as a nation react to this. In the same way, how we have gotten to this point is dependent on how we as a nation have reacted as a whole. 20% of our population is vaccinated, which means 80% of our population is not. Which means 80% of our population still remain at a higher level of risk than we as a Ministry of Health or government would like to have. We have seen in the last couple of weeks individuals, either through acts of defiance or venting, releasing, and one explanation which I definitely don't agree with, displays of culture. It's not, it's acts of defiance, have put us at risk. We have said so. We have consistently said so. We hope that we will get, and we expect that we will not stop our work until we get to the bottom of this possible cluster outbreak and to control as best as possible how far it gets. But it is not left only to the Ministry of Health. It is not a task for us alone. It is a task that we as a nation must accomplish, and only as a nation. If other individuals continue to be defiant and have gatherings right now while we're trying to get in control of this situation, and if individuals who were present at any of these events don't come forward and don't follow the instructions of the Ministry of Health, then yes, we will lose control of this situation. This Delta variant is not forgiving. It does not give us a second chance. If it is, as the CMO and myself suspect that it is the Delta variant, then we've only got one chance of getting into control of this, and we may have lost that chance already from the fact that there was a large gathering in which persons who were positive attended. Time will tell. We will monitor, and we will continue to update the public as we get more information. Thank you.
Thank you very much, Minister, for your comments. The time has come for us to provide an opportunity for members of the media who were present to ask their questions. As per usual, members of the media, we thank you for your presence at the weekly post-cabinet press briefing. We have present this morning Linda Straker, Mikey Hutchinson, MTV, Nancy Maguire. Do we have any questions yet from those who are present? I am checking the Zoom chat to see. Okay, MTV, good morning to you. You may proceed with your questions.
Good morning, Donald Houston, MTV. I have quite a few questions. Dr. Charles, my first question, how effective is the AstraZeneca vaccine against the Delta variant? And with the possible spread, the community spread, and will we be revisiting our quarantine protocols at all? Is that in the pipeline at all? Because of what we are seeing when people are leaving, they are being tested positive. And will charges be laid against those who have hosted these illegal illegal parties?
We seem to have lost Danella's audio, but we do have 3 questions from her so far. Dr. Charles, you would like to take them?
Right, so with regard to the effectiveness of the AstraZeneca vaccine, as you know, recently, AstraZeneca and Pfizer were 2 vaccines that were demonstrated to have a high level of effectiveness against this strain. I believe for AstraZeneca, if my memory serves me well, it's around 67%. But that information, I can verify and get back to her. With regards to the other questions as to whether there will be a curfew or sorts, I'm guessing that there will be a discussion. All right, there will be a discussion as to how we respond to this, but the first responsibility lies with each and everyone in the population. You cannot rely on the state to protect you in every aspect of your life and against every threat. You have to be prepared to take some level of responsibility and to, adopt certain actions and behaviors to protect yourself. And of course, we know that there are scientifically proven ways for persons to avoid infection and to protect themselves from severe disease. And first and foremost, we are encouraging everyone to adopt those. All right? And those measures that I'm talking about, wearing a mask, avoiding crowded, close contact settings, all right? Sanitizing, all right? These are simple infection prevention measures. And of course, getting vaccinated to protect yourself from severe disease.
I think there was a third question relating to charges being laid against persons who hosted the illegal parties.
As always, it's not for the Ministry of Health to lay charges or so. Once the evidence is collected, then the decision is by the Royal Grenada Police Force or the Director of Public Prosecutions. So that information will be passed on to them. Our concern right now is to control the outbreak that has occurred as a result of a gathering. In our opinion, and that's our opinion, that gathering is illegal. However, that determination is made by the Royal Grenada Police Force and the DPP. With respect to any further actions or so, Cabinet has been briefed on the current situation, and we are monitoring it day by day, hour by hour, and will make decisions based on the evidence or information as things progress.
Thank you very much, Minister. Mikey Hutchinson, questions from you this morning. Good morning to you.
Good morning to you. Good morning to the Minister. Good morning to the CMO and my fellow colleagues. My first question is whether or not you were able to link any of the clusters, be it the GOV or the two-party clusters, to anyone who has traveled recently.
All right, so what I can tell you preliminarily is that at that party that occurred on Thursday, last Thursday, there were a mixture of visitors and locals at that event. All right, and all other leads are being followed. The case from Guav was identified last night, so as you may understand, that investigation is in its infancy. So once we are able to give you more information, we'll provide it once we have it.
As it relates to contact tracing, can you just explain to us a little bit how do you do that? Who is regarded as a contact? Is it somebody that comes in direct contact with an infected person, or persons who have been within that same space with the infected person?
All right, so that is a very good question. Now, a contact is anyone who has been, let's say, within 6 feet distance of a case. All right, so contact tracing always starts with a case. All right, and we look for persons who were close enough or within the vicinity of that individual. All right, now, a close contact is generally considered someone who has been within 6 feet of someone for about 15 minutes or so. All right, and casual is out of that. But when you are dealing with highly contagious pathogens, that can vary. All right, you recall that a disease like measles, if you enter a room up to 2 hours after a case left, you can still get infected. So that varies. Now, in a party, things are very dynamic. All right, the situation is very dynamic. Persons move around. All right, so they may be very close, and then they may move away. All right, and they may spend a prolonged period of time in the general area where there's a case. So when we are contact tracing following exposure at mass gathering events such as party, we cast a wide net. And in a party like this, in someone's yard, everyone is considered a contact.
Mikey, do you have another question before we move on to another colleague?
I'll wait for the second round.
Okay, thank you, Mikey. Nancy Maguire, good morning to you. You may proceed with your questions.
Good morning. Can we get an update on our supplies of vaccines? And is there any change of approach to individuals that are still hesitant to take it in terms of dealing with them on a one-to-one basis, especially at these employee places? Secondly, I wonder if we could get an update on what transpired at the airport in terms of supplies of swabs and tests. I know that there was a report that there's lots of supplies on island. I just wondered if they temporarily ran out of supplies there. And we also have some reports coming in saying that sometimes the Ministry of Health people that are doing the tests aren't changing their gloves regularly. Can you update us on that? Thank you.
Status of vaccines. We recently received a donation of 1,400 doses of vaccines from the UK government, and we had on hand about 12,000 from the COVAX facility. All right. So up until, let's say, a week ago, we had about 26,000 doses on hand. All right. But what must be remembered is that vaccines have shelf life. So even if we have 26,000 doses come the end of September, the shelf life of even the most recent batch of vaccines that we have received, will have expired. So it's a challenge that we have to deal with, in addition to the hesitancy. In terms of the approach, I mean, when your house is on fire, it's a little late to think about how you're going to start out in the fire. Persons need to get vaccinated. They needed to get vaccinated yesterday. They needed to get vaccinated a month ago. We are talking about right now Grenada potentially having a large outbreak of COVID-19 if we are not careful. All right? When someone is exposed to this virus, all that is going to matter is either you're immune or you are not. And at this stage, that is where we are. Either you have been vaccinated or not. If you chose to be vaccinated, then you have a level of immunity that will protect you. If you chose to wait or frankly not get vaccinated, then you have simply chosen to take your chances with the virus. And this virus is unforgiving. This is a message that we were trying to, convey to the population for quite some time. And this is basically where we are right now. We still continue to educate and encourage persons to do the right thing. Get vaccinated. All right. The best vaccine, all right, is the one that you have access to and the one that you have received, and that still continues to be our encouragement to everyone.
Let me address the issue of reports of a stock out of swabs at Morris Bishop International. Last week, there was one day at which, based on the reports that I've received, because I asked for a full report from the individuals at the airport and received from the permanent secretary as well. At 4:48, the team of nurses who were doing the swabbings ran out of swabs, and at 5:10 p.m., 4:48 p.m., 5:10 p.m., the new stock of swabs were there. And they started swabbing again. 4:48 to 5:10. They were at the airport. It was a case of logistics, not the swabs not being in the arrival hall of the terminal building. That is purely logistical with the individuals down there. I blame nobody there. They were able to remedy their situation. They made relevant announcements. However, I have seen an individual trying to get into the limelight or spotlight and unfairly and inaccurately representing what goes on at the airport. I leave that individual for public judgment. The thousands of persons have come through Morris Bishop International Airport, have been swabbed, and will be able to testify for themselves that the nurses there follow all the procedures with respect to swabbing, with respect to gloves, with respect to sanitary conditions. And I leave it for the public to speak out, those who have passed through Morris Bishop International Airport, to say for themselves what they have witnessed, and not rely on one, I'm sorry, but I have to be quite frank here, newly arrived politician on the spot trying to get into the public limelight. I respect the fact that she is trying to make a name for herself, but it shouldn't be at the expense of the team at Maurice Bishop International Airport.
Thank you very much, Minister. Nancy, one more question from you before we move along? Or is that?
Yes, thank you. Yes, thank you. Could the minister provide an update on where we are with Grenadians wishing to travel and having electronic information with this app? I'm not sure where we're at, and I wondered if you could update us on that. Thank you.
Yeah, Nancy, right now Grenadians wishing to travel can do so just like any other first world nation in terms of having the hard copy of their vaccination card. We have been attempting to go further to give individuals an electronic version of that card, as well as an ID type, driver's license type version of that card, more durable. The driver's license type is available. There have been some issues logistically for us to make sure that the security and the dissemination is maintained, and that has caused some delays. And with the electronic version, some individuals were not happy with the fact that it could be accessed by someone else, and therefore to protect the privacy of the individual. So we had to delay, although it is the same security and accessibility that occurs elsewhere. We decided, based on complaints and comments we got, to go that extra distance to delay that release and put additional security steps in place for it. So that's where we are with it, but Grenadians can travel with their vaccine card, which is the same as Americans, Europeans, Canadians, everyone else in the world. It's a vaccine card right now.
Thank you, Minister. Linda Straker, you're next. Good morning to you. You may proceed with your questions.
Good morning to you, Philo, and the panel this morning. I just need some clarity with what Dr. Sean would have said. Can he tell us, at present, how much homes or houses are in isolation? Approximately how much persons in total are in isolation? Any of the person who was identified as positive, are they vaccinated or not? And will we be seeing consideration be given to the physical distancing protocol with regard especially for buses and for incoming passengers? That's what I have for now, but I do have others.
Dr. Charles?
With regard to the number of homes, I really can't say, because we have so far a total of 64 contacts identified, but we know that that is not the entire number. All right, based on the movements of some of the cases, and particularly the local cases, based on the movements about the community, it is going to be a significant number. It's going to be a significant number of homes, all right, and a significant number of persons who were exposed to these individuals. I mean, it's the unfortunate reality of these situations, and it sometimes demonstrates how we can help these diseases spread. So, with regards to numbers of homes, I don't have that number, but it's going to be many. All right. So far, like I say, 64 persons, but we know that that is only the beginning, and that does not include any contacts from the case in Guav. All right, and also the parent of that minor, their result is also pending. So it's still a fluid situation.
There was a question about persons being vaccinated, the positive cases.
All right, so of the local cases, one, the hospitality worker was vaccinated. Now, incidentally, the hospitality worker has no symptoms. All right, he was picked up via testing, but he has no symptoms at all. The other local cases, of course, they are unvaccinated.
And another question was, any consideration given to physical distancing for buses?
Right, so like I say, I'm guessing that many things will be considered, all right? But as I say, the principal responsibility rests with each individual. Do not look over your shoulder and expect that someone else will do something to protect you. You must protect yourself, all right? We hear the complaints about persons riding on the buses and no one is wearing a mask. It is because each individual took upon themselves to not wear a mask. I mean, I don't know how else we can say it. There is a concern, all right, that persons are not wearing a mask is because each individual has decided for himself that, listen, I'm not going to wear a mask, even though it's in regulation that you must wear a mask. All right? And it's the same with vaccination and the other things. It is an individual responsibility, and I want persons to first, when you think about what we are going to do to fight this outbreak, first think about what you are going to do personally to prevent yourself from getting infected. And let's start there.
Thank you, CMO. There's a question, Johnson, I presume this is Johnson John Rose. You have questions? Good morning.
Johnson John Rose. Hello?
Johnson Richardson, I'm sorry. But John Rose is a media colleague. I'm very sorry.
I was wondering. Anyhow, let me say good morning to your panel. And of course, my question really is, from listening to the CMO, the hospital worker that you mentioned, and of course the people at Northwest. Northwest had no travel history, and so on. Are you in a position to say, so what are the people in Northwest, or the people, are you able to spot or identify the source of the spread in Northwest to up until this point? Because you mentioned that there were different people there. There were locals and visitors. Are able to identify the source of the spread at this point? And my second question is,
yes, please give some time because I have to jump back the Empress briefing.
Okay, vaccine is not coming in today again.
Okay.
We do apologize for that interruption. Johnson, please proceed with your question. Johnson, if you can hear me, please proceed with your question. We're not hearing anything. Can you please go ahead? We had a brief interruption, but you can go ahead now. I do apologize.
You got my first question. Yeah. So let me ask my first question was, the people at Northwest, they had no travel history. Are you able at this point to identify the source of spread of this virus in that area? I know there were different people there, local and visitors. Are you able to identify the source of spread of that virus today, and to speak to whether or not they were quarantined, if they had any travel history, the source? And my second question: 20% of the Grenadian population to date are vaccinated based on the records. And this, of course, is the lowest in the region. Could that be a case of the method used by the authority in disseminating that information relative to vaccination and its effect? Or is it a case of total defiance on the Grenadian population with respect to vaccination? Thank you.
Right. So finding the source of the infection is part of our mission, is part of our purpose in conducting these investigations. Like I say, we have identified 5 individuals so far who were infected. It is an ongoing thing. All right. At this time, I cannot tell you who was patient 1 or patient 0, or who was patient 5. All right. We have put them in the order in which we have identified them, but that in itself is arbitrary. Investigation is ongoing as to who or what is the source of this infection. Like I said, it was the activity contained a mix of visitors and locals. All right. So as we go on, we hope that we will identify this source that you speak of.
To speak on the vaccine uptake, the methods used here in Grenada are the same that are used throughout the Caribbean, in fact, throughout Latin America and the Caribbean. The vaccines being used here in Grenada are the same as the vaccines being used throughout the CARICOM. The difference is that Grenada, to date, up until this weekend, has not had any community spread. And therefore, many of us have not seen the urgency or the need to take the vaccine, regrettably. My hope is that it is not too late for some who will come forward to take the vaccine, and that we will do as best as possible to protect the 80% to date that are not vaccinated. But it does put undue pressure on the system. It is not a situation that we would like to be in, but it is the reality, and therefore we must deal with the reality. We need to take personal responsibility, all of us as individuals. I see postings coming on now and in the last couple of days for individuals calling for us to increase the quarantine period. Have persons entering Grenada stay 14 days or 10 days or 5 days so that the rest of us could remain defiant and not comply with the regulations? No. Trinidad's borders were closed fully with 14-day quarantine when they had their breakout. New Zealand has a 14-day quarantine and they have a breakout that they're dealing with now. When we had our one fatality, that individual tested positive after 14 days. Did their 7-day quarantine. Back then it was 7 days. And it was an additional 7, it was almost 14 days afterwards that he tested positive. So the members of the public who are still believing that it is for quarantine and border control to prevent us and not personal responsibility, I think we need to wake up. It is personal responsibility regardless of the country. This is not a Grenada pandemic. This is not a Grenada epidemic. This is a global pandemic, a global epidemic. And some of you making comments on social media are making comments from countries that have community spread right now. But you're not making those comments to the governments that where you are. We have done our best as a nation, and we have done very well, better than most. But we have consistently said that we are not perfect, and the system that we have put in place is not perfect, and that the only way that we can mitigate this is with all of us doing our part. That if one drops the ball, then it will get in. COVID-19 will not stop. It will keep pushing and trying. So the questions about which gathering and who was source patient 1 or so. Patient 1, let's consider personal responsibility and make sure that we are not patient 500 or patient 5,000. The number of persons on a bus? No, let's make sure that we wear our masks when we're out in public and practice the proper sanitary conditions. Then it will not matter how many people are on the bus. because we would be practicing the methods. Remember, the nurses dealing with the COVID patients, they're right there. They're touching them, they're right there dealing with them. But because they are practicing the proper methods, they don't get infected. And all we are asking the public to do is the same. Practice the methods. When you go into a crowded space, like a bus, wear your mask. When you come out, sanitize. When you enter, sanitize. If those things happen, you will see the bus will not be a source of the spread of COVID-19. The sources of spreading of COVID-19 are where protocols are not followed.
Thank you very much, Minister. We have GBN also present this morning. Some questions were submitted via text, but I think GBN has now been able to join us. GBN, good morning to you. GBN, are you there? If not, we'll move right along.
Yes, I'm here.
Okay, go right ahead with your questions.
Good morning, everybody. There was a question posed by Donella this morning that I'm not sure was answered, so I'm going to ask again. At least 2 or 3 of the cases recently identified in the last week were as a result of exit testing, which brings the question, would any changes be made to the quarantine requirements for fully vaccinated people from 48 hours to possibly more? And as a follow-up to that as well, of the visitors who were at the quote-unquote illegal parties, farewell parties, were any of them, the positive cases, one of those who tested positive on their exit? And thirdly, I know the primary response would come from the Ministry of Education, but with the minor being one of the positive tests, have any considerations been given to what would take place when school reopens in about 3 weeks?
Let me just deal with the one with respect to the entry protocols and the length of quarantine. The Ministry of Health and the COVID Committee have constantly evaluated, re-evaluated, and constantly look at. So yes, there is a possibility, as there has always been a possibility, as we have adjusted. We have increased and we have decreased as this virus has, and the global situation has varied. As to whether there is merit now, most definitely, to look at and to make an assessment and to make a decision. That is being done as we speak. And an assessment and a decision will be made with respect to the length of quarantine and how we deal with individuals coming in or leaving Grenada.
Yeah, and I would just like to say that we should not look for false sources of comfort. Moving the quarantine from 14 days to 7 days to 48 hours, or from 48 hours to 14 days, none of this will prevent you from getting infected. This must be understood. None of this will protect you from getting infected, because if you choose not to follow the protocols and you're exposed at any point in time, you will get infected. So I do not want us to give the public a false sense of security that if we suddenly move that quarantine period to a longer period of time, that they are somehow protected. This is a false belief. This is a fallacy. All right? Secondly, with regard to the question on exit testing, 2 of the individuals tested positive on exit testing. All right? So that's the answer to the second question.
And there was a third question given the yes.
Yeah, with respect to schools, the opening of schools or closure of schools or delay of opening of schools also is based on the epidemiological situation in the country at that time, leading up to that time, as we get closer and closer to that September opening. Having a minor test positive is a serious issue that I'm sure the Minister and Ministry of Education will be looking at as well, but it's more a case of the epidemiological situation. So this child would not have been infected by preparing to go to school or going to school. This child would have been infected based on the activities of the parent. So that I think we need to focus on as the reality in this case.
Thank you, Minister. Kevin Frederick, you have a question? Kevin, good morning.
Philo, thanks for the opportunity to ask this question briefly. CMO, I just wanted you to put something into perspective for me. The Director of Medical Services at the University Hospital Jamaica said that what they are seeing now is that persons who are unvaccinated are not being hospitalized that much. However, the unvaccinated people are accounting for more than 90% at the hospitals, and he's saying that clearly the science is backing that vaccines do work. Now, in light of what you have just explained earlier, the gravity of the situation here that confronts us at this time with the 64 contacts that are already identified, can you put into perspective for me as an epidemiologist the multiplier effect here in light of the fact that the Delta variant is highly transmissible with a rate of 1 to 5, and juxtapose that to our ability to comprehensively manage and treat the situation? Now, I'm asking that question because our vaccination status borders just around 20%. But what can happen? Could it be dire outcomes for us, given the fact that if we were to have such large community spread, and looking at persons who are positive and non-positive persons requiring care from our medical response? How gloomy does it appear for us?
So I think we are all aware that this third wave has been called a pandemic of the unvaccinated, because in large part it is the unvaccinated who are being infected, it is the unvaccinated who are being hospitalized, and it is the unvaccinated who are dying in their droves. All right? So this is a well-established fact. We have also gone to great lengths to explain to the public the constraints that we are presently working with. Everyone knows that our health system has many challenges. All right, we have challenges with resources. We have challenges, which includes personnel. We have challenges with the equipment. We have challenges with space. All right, and having additional expertise to deal with a pandemic of this nature is also an issue. All right, so all of that is out there in the public. So when you have a very infectious variant, because what is observed now is that the Delta variant has literally taken over the world. All right, in every region, this is the predominant variant that is circulating. So it is a variant that is going to reach us, and it's the variant that we fear that we may be seeing here. When this occurs in a setting like ours, all right, it can be devastating. It can be devastating. All right, that is if we are not careful, and if we do not listen, and if we do not follow the rules. All right, this is the time for us to act. All right, this is the time for us to act. This is not the time for us to continue those petty arguments, whether it's on social media or wherever else. This is a time for everyone to act, come up with solutions to protect your own family. All right, because we would have persons going out there, attending gatherings, mingling with persons who are exposed and not yet identified, and then carrying this disease back home to their aunts and their uncles and their grandmother and so on, which can be devastating. All right, this is the time to act. That's all I can say.
Thank you very much, CMO. We have just a couple minutes left. Linda Straker, you had a follow-up question? Linda, go right ahead with your follow-up.
Yes, thank you very much. My follow-up question is, after hearing so much, can the minister or Dr. Charles say to us whether there is any indication that there are persons who have entered the country using fake documents? This is well known. There are many articles on it, what happening in New York and other parts. People are selling those documents and airports and so. Is there any indication that in recent times you would have seen persons entering with fake documents and probably being caught on the way out? And what is the age range of the persons who were recently affected? You did mention a minor. Is this a minor in the lower category or a higher category, meaning like under 12 or above 12? Can they shed some light to us to that? Secondly, because of what we're hearing and seeing this morning, will the ministry be undertaking testing in communities, screening in communities, so we can have maybe a clearer data as to what is really happening in our communities?
Linda, on the issue of fake documentation or false documentation, false declarations, we are constantly looking, not just us, but you've heard comments from other Caribbean islands as well, and internationally. We have had some suspicious cases, and upon verification have proven to be correct documents, but we are constantly looking.
All right, so as it relates to the age range, presently the active cases we have from as low as 12 or so to as high as 50. Screening in the community, I mean, right now we are engaged in intense contact tracing with the limited personnel that we have. All right, so our actions right now are targeted. We are trying to identify those persons that we know were in settings where there are positive cases, and these settings could have been super spreader events. All right, so our actions right now are targeted. Screening in the community, it will be helpful, but like I say, you are aware of the constraints that I recently mentioned. All right, the same staff that has been fighting COVID from the start is the same staff that is out there right now, finding all these contacts and testing them and all of that. And it's the same staff that we have that are simultaneously doing vaccinations and maintaining all of the other health services. So you could see the constraints. We are working to the best of our ability right now. All right, so that's why, if the public is cooperative and is, and decides to go along and help us, we can all get out of this together. But if we get resistance and we get this continued, defiance and all that, I can guarantee you that we will all go down together. All right, because as I say, this virus does not negotiate and it does not care who you are. All right, so that is basically my message.
CMO, given the fact that you mentioned that it's the same staff that has been working, throughout the pandemic, I just want to look at it from the other side of the coin for now, focusing on these workers themselves. Is anything being done to help, with their mental, psychological state, given what they have had to deal with for the past year plus?
Well, let me just say that I wish more could be done, because they really have been working very hard, tirelessly. And I know that they are fatigued. And I know that this is the worst time for this to occur. All right? But thankfully, we have a dedicated group of health professionals that have kept Grenada safe so far. And they continue to work despite being very tired. All right, despite putting in long hours, they continue to put in the work. At times, they get discouraged by all of the rhetoric that they see that is put out there. All right, because it seems as if they are fighting the pandemic and they are fighting the public at the same time. But they continue to work. They continue to put in the work. and they continue to do so diligently to once again get us back to that state where we all feel safe.
Thank you very much, CMO. I see quite a number of questions still coming in. Nancy Maguire, you have a follow-up?
Yeah, yes, I do. Thank you. Last month, the Prime Minister had said Grenadians would soon have a choice in vaccines and that younger people would be able to be vaccinated. So could you, give us an update on that and whether the numbers you provided at the beginning included those? Thank you.
Yes, Nancy, thank you for that question. As I've been consistent and not announced vaccines until we have them in our possession, but because of how close the imminent delivery is, I have communication from CARFA as well as from U.S. Embassy that we are to receive our shipments tomorrow and Thursday in two parts of 29,250 doses of Pfizer-BioNTech vaccines. I also have, which is creating a little bit of a confusion for us, from the shippers that it's arriving today. So we are on standby for the 3 days. Embassy and CARFA has said tomorrow and Thursday. Shipper has said today. If it comes today, tomorrow, or Thursday, we are most happy, prepared, and ready for it. On all three, they've given the right times, which is 3:30 in the afternoon. So we would invite the media, once we have confirmation of the actual arrival, to be present for the shipment of Pfizer-BioNTech vaccines.
Thank you, Minister. Nigel Mathlin, good morning to you. I do acknowledge that you had your hand up for a while, but I was so focused on those who were sending messages in the chat. So my apologies to you, but you have the floor. Go right ahead.
Thank you, and good morning to the panel. Especially in light of the community spread and without taking the lockdown approach like New Zealand, for people in Grenada who now think that they may be exhibiting flu-like or COVID-like symptoms, would you recommend self-isolation, and can people get tested voluntarily, either for free or at an affordable rate? And I'm speaking apart from Ministry of Health initiated contact tracing. And my second question is, does the Ministry of Health have any policies in place regarding what will trigger changes to restrictions and guidelines, or is this something which is internally debated as each new incident arises? My concern is that community spread was anticipated, but you mentioned earlier that it will now be discussed to determine if any changes will be made. But the situation can change and get out of control very quickly. Thank you.
Nigel, I'll leave most of that question to Dr. Charles to answer, but just simply to comment on the difference between community spread and cluster. Right now, by all intents and purposes, we're dealing with a cluster. If the evidence shows otherwise and that it is community spread, then yes, we will take the necessary action. So just want you to be aware that there is a difference. We do not have community spread at this point in time. We hope we will not have. We have never had community spread in Grenada. We have had clusters in the past, and we have taken necessary action. And we will not hesitate to take that action again, whether it is later on today, tomorrow, or whenever the relevant information, facts, and so present themselves for us to take that action.
All right. So, firstly, if anyone knows that they attended any of the events that I spoke of, our healthcare team is presently looking for you. So we ask you to call your nearest health center or medical station and identify yourself. All right, that's first. Secondly, if anyone has symptoms, suggestive symptoms of COVID, all right, we ask you also to contact your local medical station or health center, all right, or health team, and in addition, you must self-isolate at home. All right, if you have symptoms, you self-isolate. All right, at your home, you reach out to any of our medical stations or health centers, and a member of our team will come and do the testing at home. So we do not want these individuals going out there in the public and circulating. Thirdly, I think there was a question as to are there like fixed points where we will trigger lockdowns and so on. There are many factors that must be considered when you take such large and drastic steps. All right, and we have a committee that a multi-sectoral committee that sits and discusses these issues, and we come up with a rational approach. All right, with regards to restrictions and what are the next steps, and this is the process that we use. All right, and we will continue to use. This process has kept us safe for a long time. Even as the world was crumbling around us, we remained safe for a long time because of the processes that we followed. All right, it's not the time to abandon them. It's time for us to, continue the work, tweak where necessary, and move forward.
Thank you, CMO. Okay, members of the media and to our listening and viewing audience, we will allocate maybe an additional 10 minutes or so to this press briefing. There are a number of questions still to come from members of the media. I've acknowledged Mikey Hutchinson, Johnson Richardson, Nancy Maguire, and the GBN, all with follow-ups. So I will go now to Mikey Hutchinson. Go right ahead, Mikey.
All right, thanks again. And the Ministry of Health, the CMO, and the Minister, they have been really consistent in encouraging people to follow the protocols and so on. But a certain rhetoric was presented this morning by the Minister that concerns me. And with all due respect, I'd like to make a comment before I ask the question. The Minister alluded to the fact that people are concerned about the entry protocols and so on so that they can justify their defiance. But the CMO have already said that these protocols that we've been asking people to follow, they are not foolproof. These are just simple measures to minimize the risk. And there is a correlation between who enters the country and how they enter the country and the level of risk that presents to the society. So, of course, we will be concerned and want to know what you plan on minimizing the risk as the authorities for the greater population. So I think that is the context in which the questions is being asked, more to correlation rather than causation. And so that's why you're going to get questions about the buses and so on, because these as well minimize the risk based on the amount of distances that we are allowed and so on. But moving on to my question, prior to this outbreak, have you seen positive cases being associated with any businesses or institutions? And if so, what do you think is the reason for that?
On the issue of the entry protocols and the risk assessment, yes, we're constantly evaluating the risk assessment. Weeks ago, you would have heard us, I definitely said it, that the regional and global situation has changed because of the Delta variant, and therefore we need to be more diligent. We need to recognize that the risk has increased. But there's no particular country because it's all over. And I said it and I got criticized for it, but I'll say it again. We cannot expect Grenada to be any different. That the best of countries, every single country in the world has had Delta variant enter it, basically, at this point in time. And I'm not sure why we would think we would be any different. We need to take the necessary precautions. We need to recognize that the threat is real. And we need to recognize that what needs to be done to prevent the spread is personal responsibility. Each individual. This variant will attach to any one of us who is non-compliant, and that will be the individual it will use to spread. The rest of us who are compliant are the ones that will help to prevent further spread. But it's through non-compliance. It's through gatherings. Look, Dr. Charles and his team have a much harder task now tracking down who was present at that event. because no logs were taken, no phone numbers, no names. So it's based on people's memories, no times. So it's much harder for them. And we've said what are the things to do, to follow, to help us get control of the situation. But when it happens at an event like this, which is one of our worst fairs, which is what we have said as well, it's very difficult for us to get in control of the situation.
I wanted to add because what you need to understand is that there have been more positive cases among returning Grenadians than among visitors or otherwise. All right, many more. The majority of the cases that we've identified are among returning nationals. All right, so when persons talk about restrictions and so on, I am not sure that we are prepared to prevent our own relatives from returning home for vacation or otherwise. All right, so I say that so that persons understand the context within which we operate. This is not a disease that affects them and not us. The majority have been Grenadians that are either living in the diaspora or have traveled and returned home. Thank you.
Thank you. Mikey, anything further from you quickly? Maybe just one more if you do have one. We need to move on.
Let the others go ahead.
I'm sorry, I didn't hear that, Mikey.
I'll allow the others to go ahead because I realize we're out of time.
So we move on to Johnson Richardson. Johnson, go ahead with your follow-up, please.
Yeah, thanks again for allowing me. Mr. Minister, can you provide an update on the situation at the polyclinic at Guav? I know the construction work has been ended for a while, and the doors remain closed. Can you provide an update on that facility? So to when can we see some service being provided by that particular facility? And my last question though is, what I commend, let me just commend the health workers, particularly those at the Maurice Bishop International Airport, for their level in maintaining the low numbers that we see in Grenada for the last couple of years, just over a year or so. But Mr. Minister, can you for another time explain why up until this point Grenada maintained to have the highest PCR testing? The cost of PCR testing in Grenada is probably the highest in the world. Can you provide some answers of this? Why we maintain that? At the same time, we have private facilities in Grenada that are of a much lower cost. Can you explain so?
On the issue of Gov Polyclinic, as far as I'm aware, I've received no information otherwise. It is still on schedule for a late August, September opening. I will endeavor to get an update just to confirm that through you, Philomena, or having the ministry do a release later on today on that to update the public. With respect to let me thank you for recognizing the yeoman service being provided by those at Maurice Bishop International, the team there, all of the team, the wardens, the nurses, the individuals doing the screening, MBIA staff, all providing yeoman service. The cost of the PCR, what I can say is that the cost of the PCR in Grenada is not subsidized. A lot of other costs within our healthcare system are completely subsidized and sometimes free. I think it is unfair and unreasonable of individuals to single out the PCR test and do a comparison of the PCR test. Why don't you compare the cost of surgery? How much it costs to do surgery at the general hospital compared to other countries for outpatient services, other outpatient services, and so that are totally supervised, supported by the government, that the public does not pay for. So the cost of the PCR, yes, it is not subsidized. The government makes no apologies for that. It is not a budgeted cost that we expected to deal with. The costs that individuals have to pay, they have to pay based on travel. The world still says, and we still say, please avoid non-essential travel, and there is a cost to travel. Going into the UK, there is a cost for that PCR test as well. going into the US. In most cases, you don't have to take that PCR test, but I know in many states you do pay for it. So it varies from country to country, state to state, region to region. All I will say and can say is that the cost of the PCR test in Grenada is not subsidized.
Thank you, Minister. Moving right along, Nancy Maguire. Nancy, please go ahead. Okay,
I have no more questions, thanks.
Okay. Okay, Nancy, thank you. GBN, you had a final question?
Yes, I do. In relation to the recent cases, do you have any concern in relation to any one of those cases being at some of the recent gatherings, be it the Juve-like activities, the celebrations in Guave, the Olympic celebrations? Secondly, do you have a breakdown of vaccines administered per parish that you can share?
Let me address that. Let's go back with that question that you asked, whether we have concerns of the positive case attending any of the activities that we beg the population not to have. So let me repeat that again. You are asking us if we have concerns that any of the positive cases attended some of the activities that we pleaded and begged the population not to have. I think that gives you your answer. We pleaded and begged the population not to have these activities. Now you come and ask if we are concerned. Yes, we are concerned. That's why we pleaded and begged not to have these activities. That's why we said there should be no carnival this year. That's why we are critical of some radio stations, and if it is your radio station, then you need to recognize it, that promoted some of these activities, that encouraged people to attend these activities instead of discouraging. Some DJs I did hear, and some hosts discourage people, but I did hear many encourage people to attend. And now you ask if we are concerned. Yes, we are concerned. What we wish is that you were concerned as we are now back then, when we said, do not have these activities, please. And there's some members of the population saying, why didn't the police stop and why didn't? No. These are Grenadians going out for themselves and deciding to be defiant, falsely using culture. Shame. Our culture is something that we are all proud of. But displays of culture should not be at the risk and lives of our individuals, and that's what some of us have done. So yes, we should all be concerned that some of these positive cases were present at some of these events, and there is absolutely no way for the Ministry of Health to do any contact tracing on that. None whatsoever. We just have to throw our arms up and see where the chips fall if one of those individuals were at one of those activities. That's the reality. That's why we pleaded and begged the population not to have those activities.
Thank you, Minister. Okay, no further questions from what I can see here. And
sorry, he didn't. Sorry, Ms. Robertson, he didn't answer the one
thing. Sorry, go ahead.
He didn't answer the one about
the vaccines per parish.
Yeah, sorry, Dr. Charles.
Yes, we do have a breakdown on the number of vaccines administered by parish, but of course that can be provided. We have not published that, but that can be provided. But as you would imagine, it would be heavily skewed towards St. George, because St. George is where the bulk of the vaccines are being administered. Now, with regards to the concerns, yes, we are very concerned, and note that the vaccine, the cases that we are noting are coming from, at least outside of the more urban areas. All right? And incidentally, the further you go outside of St. George, it seems like the worse the vaccine coverage is. So it is not a surprise that you're seeing cases popping up in these areas. and we shudder to think, what is coming next. All right, everything is connected, and we await to see. But we are also concerned about maybe the one that we missed, and that attended, maybe that jump up on that side of the island, and then hopped over to that side of the island to continue the celebrations. All right, it's all fun while it's happening, but then the consequences that follow sometimes can be really unpleasant. So all of these are reasons for us to be concerned.
Dr. Charles, while you have the floor, I'll invite you to make your closing comments this morning. A question has popped up in my chat several times this morning in terms of the location of the event that we were referring to last Thursday. Can we just disclose what that is?
Yeah, that event incidentally occurred in the village of Happy Hill. All right, so the persons who have been to this activity, please identify yourself to the health care workers so that we can do the necessary follow-up. Now, in closing, as I've said before, we are here now. All right, it does not matter, what you think. It doesn't matter what you believe in. All right, it doesn't matter what you think that the Ministry of Health should do or the government should do. What matters now is what you are prepared to do to protect yourself. All right, this is no longer an issue for someone to fight on your behalf. All right, we know, as I said before, there are scientifically proven ways to avoid infection and to avoid severe disease. We encourage persons to use them right now. You should wear a mask, all right? A mask that covers your mouth and nose, similar to what I have on right now, or the way I'm wearing it right now, properly covering your mouth and nose when you are out in public. You should avoid crowded, close contact settings, no matter where they occur, but especially in indoors. You should avoid these settings at all costs. All these little clandestine gatherings, you are not escaping. You are only harming yourself and potentially harming your family. You should sanitize. And if you haven't done so yet, we still have vaccines on hand, and we encourage everyone to make use of them. Any local death from COVID going forward is an unnecessary death because we had the tools to prevent them. All right? We should stop making excuses, and we now need to do what we need to do to prevent this unfavorable situation from turning into a catastrophic situation. And that would be my encouragement to the public.
Thank you very much, CMO, for those closing words. Honorable Minister, your final words this morning.
Yes, we are, as the CMO said, we are where we are right now. This is a situation that we've tried to avoid as long as possible, but we've also said that it would happen, that we need to do as much as possible to avoid it. The questions being asked about quarantine, I've already commented on it. There is no foolproof quarantine system or border control. Every nation has found that out, and there's no reason why Grenada would be any different. But we will evaluate and we will make necessary adjustments, if needed, on the quarantine and entry protocols. But what is most important is how we deal with COVID within our borders, because COVID doesn't necessarily have to enter through one of our legitimate ports. And I use the Trinidad example as well as St. Lucia. It did not enter the first time through their ports. It came in illegally. And we have had instances of individuals trying to come in illegally into Grenada as well. So what we need to do is to take on the personal responsibility, and the Ministry of Health has been consistent. And we will continue to be consistent. Use all of the tools available to you. Sanitize your hands. Wear your mask when out in public. Get vaccinated. Avoid, do not go to large events, especially and in particular, illegal large events. You may be hiding and getting away from the police and the Ministry of Health. But regrettably, you may not get away from COVID-19. And that's what we've been pleading and begging the nation to follow. And some people have taken joy in being able to throw caution to the wind over the last couple of weeks. And some radio stations have actively promoted those events. And then we get a GBN reporter asking me about whether we're concerned. I think the GBN reporter needs to ask their GBN management whether they promoted those events or not, and what they're going to do. How are they going to help the Ministry of Health and Contact Tracing now? Because they helped the promoters to promote the events. What are they going to do to help the Ministry of Health to figure out who was there? That needs to be taken into consideration. Personal responsibility on this. Consistently, is the Ministry of Health and the government? No, it is us all as a nation. That's how we will get past COVID-19. All together or not at all. That's how the United States will get past it. That's how Trinidad will get past it. That's how Barbados, St. Lucia, St. Vincent, New Zealand, United Kingdom, Grenada will be no different. This virus has no respect for political affiliations. This virus has no respect for income levels, the job you do, your religion, not at all. This virus just respects one thing with you, that you gather and that you associate without wearing a mask, unvaccinated, or without following the protocols. And this virus will love you and will not leave you. The choice is yours. We will do our best. As to whether our health system gets inundated or not is not based on the level of preparation we have put into it and the facilities. It is based on the behavior of the public out there. As to whether we will have 5 cases, 10 cases, or 500 cases is not based on the preparation and the hard work of Dr. Sean Charles and the others. It is based on the behavior of the public out there. And we will decide as to whether, as a nation, whether our health system gets inundated or not. We will decide as a nation how many will get infected. We will decide as a nation how many may die. The same way we decided as a nation how many play jab. It's us. We did it all together. And we must own it. We will do our part to protect and save lives. But we all have to take a personal responsibility, in particular, those media houses that helped encourage people to get there. And I look forward to those responsible media personalities and media houses to comment on it and to help us to get people to follow the protocols and to understand the seriousness of the situation we're in. Thank you.
Thank you very much, Honorable Minister. That brings us to the end of this morning's post-cabinet press briefing. I had with me the Minister of Health and Social Security, Honorable Nicholas Steele, and also the Acting Chief Medical Officer, Dr. Sean Charles. The takeaway from this morning is that we have a concerning situation here in Grenada with the identification of a possible COVID-19 cluster. It is not community spread, as Dr. Charles indicated. However, only time will tell whether or not we graduate to that stage. We are where we are now, but the key consideration is how do we move forward? How do we get out of this current situation? The government of Grenada can only do so much. we all must take personal responsibility to protect ourselves, our families, our loved ones. Follow the protocols, get vaccinated, that's the rallying call, and we all have to work together to get out of this situation. That brings us to the end of this segment of the post-cabinet press briefing. We actually do have a second segment, and I do invite members of the media and the listening and viewing public to stay tuned. We'll take a quick break, and when we come back, we'll have the launch of a humanitarian initiative that will benefit the people of Cuba. Do stay with us. We'll be right back.
Prevent cold and flu by washing your hands with soap and water for at least 20 seconds. That's the time it takes to remove most germs.